Hello, everyone. This is Tanya Stark. I'm an AAP compliance consultant here at ERA. Before we get started with the meeting, I want to go over a couple of housekeeping items. This Lunch and Learn is being recorded, and within the next day or so, everyone who participates will be receiving the recording along with the presentation. In order to save bandwidth, we ask that all participants turn off your video and mute your speakers, please, mics, please. And there's a disclaimer I need to read to everyone. And can still someone just respond back and let me know you can hear me?
I can hear you.
You're loud and clear.
Okay, great. Okay. It was really quiet, so I was wondering. Okay, so the disclaimer is, okay, the contents of this presentation are intended to convey general information only and not to provide a legal advice or opinions. Employers Resource Association is not a law firm. It does not provide legal advice. Use of and access to this webinar and presentation do not create an attorney-client relationship between reader, trainee, registrant, and Employee Resource Association. Okay, and this today's Lunch and Learn is worth 1 SHRM credit point, and I will be sending that out later on along with the copy of the presentation and the link of the recording. And so we've got 4 presenters today. We have Diana Small, who is the ERA Director of Human Resource Consulting. She is going to be presenting us with the service agreement submission process that we have for 2022. And also she's going to be giving us an update on the AAP verification interface. And then we have Melissa Weimer, who is our ERA HR compliance consultant. She is going to be giving us an update on the vaccination mandate toolkit that we have here at ERA, also hotline assistance. And then myself, who I am going to be giving an update on our new AAP platform, along with data submission templates and a submission checklist. And then we have a special speaker today, our guest speaker, who is Latha. And she is currently holds a law degree, she currently holds an Ohio law license. She has approximately 15 years in private practice. Sorry, I need to move this over out of my way. Starting in 2013, she pivoted into HR compliance, and she worked for First Energy from July 2013 to May 2021. Currently works at Lincoln Electric, and she is a board member for the Ohio ILG. So, Latha.
All right, thank you so much. Can I share my screen now?
Yes, please.
Okay, I think you have to stop sharing, right?
Let me, 1 moment. You share. Yeah, no, I don't have to. You can go ahead.
I see your screen, Latha.
That's not me.
Okay.
Oh, top 2. Okay, got it. Okay. All right, everybody. I am going to get started here. Can you see my screen? Just somebody say yes.
Yes, we can.
Yes,
Okay.
but it's not in slideshow mode.
I'm doing
yet.
that right now. I just wanted to make sure that you could see me. Okay. All right. I'm going to go ahead and get started because we have a lot to cover. So I'm just going to skip right to the substance. So the first thing that I'm going to talk about, along with a couple other things kind of at the same time, because everything goes together, is, as everybody on this call most likely knows, there are different federal vaccine mandates that are happening, or at least trying to happen. The one that we are most concerned with today, of course, is the federal contractor executive order that deals with vaccine mandate, and that's Executive Order 14042, what I call the federal contractor order. There's also the OSHA ETS order, and then there's another order for healthcare employers. And so I'll talk about the other two, but primarily we're going to be talking about the federal contractor executive order. So first, what is the scope of this? Okay, so on face, the only federal contracts that are covered by this executive order are contracts under the Davis-Bacon Act, Service Contract Act, concessions, that's actual like concession stands, and federal property or lands contracts. It also includes work on or connection with a covered contract. So that's meant to swoop in like corporate employees who may be working in connection with a covered contract. So on face, the federal contractor executive order only applies if you're a federal contractor that has any or all of these federal contracts. However, and that's a big however, if you've reviewed your contracts and you've decided that you don't fall into any of those categories, which a lot of federal contractors have surmised, you're still not out of the clear, because the regulations state that a federal agency can insert a clause requiring vaccine compliance even in a contract that's not covered by the executive order. So if you're negotiating a contract and the agency wants to put it in there, if that's something that you consent to, then you're going to have a vaccine mandate in your workplace, or on the subsection of the employees that are subject to that contract. So the caveat here is make sure that your supply chain folks and whoever you have negotiating federal contracts knows about this. I've already heard of several situations where an agency has said, well, I want to put this contract in there, even though this contract doesn't fall under Davis-Bacon's service contract, concessions, federal property or lands. And the employer has said, well, forget it then. We're not going to sign this contract, and they don't go through with it. So really it's on face, it's one thing, but in practice, it can be much more large in scope. So we have to be aware of the ability for these federal agencies to put that in there. Okay. So in essence, what does this mandate do? It says, get vaccinated by the deadline, which I'll talk about in a minute. What does that mean? Fully vaccinated, at least right now. Honestly, I think that the CDC is going to move to probably modify the definition of fully vaccinated soon with boosters, but right now, fully vaccinated means 2 weeks after 2 shots of either Pfizer or Moderna or 1 of J&J. There's also other vaccines that are approved by the WHO that are also acceptable. There are only exceptions where required by law, and we're going to talk about both of them. And there is no testing alternative under the federal contractor executive order. It's either, if it's implemented, it's either get vaccinated or leave. Okay. All right, I just wanted to see what the chat was, if it was a question for me. So it's either vax or leave, unlike the OSHA ETS, which we'll talk about, that has the testing alternative. Okay. I'm trying to get that thing out of my way, but I don't know how. All right. So before we get into the substance of everything, it is very confusing with 3 different potential vaccine mandates, federal mandates out there. So I wanted to just quickly talk about the litigation status of them, because I think it will affect how your company is going to decide how to prepare for this. And I think that every company is going to have to decide their philosophy of implementation. I've known everything from employers, federal contractor employers who from the beginning, even before litigation started, saying, none of this is going to hold up. We're just going to keep doing what we're doing. If this ever gets implemented, we'll deal with it then, to, employers who have immediately started preparing for compliance. So there's a whole gamut of things, and it's going to be up to the employer to figure out what they want to do. There's no easy answer. I wish there was. I wish I could say, well, this is what's going to happen, and this is what I recommend you do. And I just can't say that because everything is really up in the air, as you can see here. So what am I talking about? So of course, I'm talking about the Federal Contractor Executive Order 14042, okay? What is the status of that? Well, as of this morning, because this weekend was a flurry of activity, at least for the OSHA ETS. So I say this morning because I don't want you to look back on these slides and say, she said that I was at 12:20 and then some decision comes down at 4 p.m. today, from the 11th Circuit. So right now, this order is on hold. And I will go through the history of why, but right now it is on hold. Technically, federal contractors who are subject to this order do not need to be compliant with it right now, technically. Again, it's a question of, what kind of risks you want to take in case it gets implemented. If it's implemented, the compliance deadline is January 18th, just around the corner. Then there is the OSHA ETS. This is the one that has gotten the most press because it involves private employers with 100 or more employees that are not subject to the Executive Order 14042. This one, as of this weekend, is going forward, and I'll talk about what happened there. Also over the weekend, the OSHA ETS deadline was extended by the Biden administration to now February 9th, 2022, and we'll talk about that. And then there's another order dealing with healthcare employers that are not subject to the OSHA ETS. This one is on hold in Ohio and 23 other states. It's a very technical reason as to why. I am not going to talk about it. It's going to take up way too much time to explain, but basically just know that in Ohio, it's on hold. It is going forward in 26 other states. Therefore, there is a lot of confusion. CMS, the Centers for Medicare and Medicaid, they are scrambling to put out new guidance because the compliance deadline is January 4th. So that's another problem if you are subject to that. Okay, so let's talk about the litigation status of the Federal Contractor Executive Order. So there have been a bunch of lawsuits since the last time I spoke about this, which was just a couple of weeks ago. Instead of going through all the different separate lawsuits, I can just tell you that reading some of the briefs and the arguments, all of them contend that basically the president overstepped his authority with an overbroad vaccine mandate and other issues related to scope. Okay, the issue is scope. Interestingly, there's really not an argument here, unlike the OSHA ETS that talks about, privacy rights and constitutionality, because we are talking about federal contracts, and it is a privilege to do business with the government. At least that's the thought. So interestingly, almost all the arguments against this were around scope, and I tend to agree with those arguments. I read some of the complaints in these different lawsuits, and there are a ton of federal regulations and laws that seem to be perhaps being violated by the administration's putting this order out. And I'm not going to talk about those because that's like another seminar. But there are a lot of different prongs that states can rely on to oppose this, and also federal contractors can rely on. So what is the latest? there were a bunch of lawsuits that were in different federal districts. You might have heard about the one that came out of the Kentucky District Court at the end of November that covered the Sixth Circuit, and so it was news in Ohio, but that was just for that circuit. Fast forward a couple weeks later, on December 7th, a district judge in Georgia instituted a nationwide temporary ban on the order, nationwide. And the reason is because there was an intervener in the lawsuit, Association of Building Contractors. They have contractors all over the country, and so it would have been mass confusion if there was anything less than a nationwide injunction for that. So that's why it's nationwide. 2 days later, on December 9th, as expected, the government appealed this decision to the 11th Circuit and asked them to reconsider the decision, asked them to basically stop the order that blocked the mandate. And they basically argued the inability for the government to work with federal contractor employees. So what now? Well, whatever the 11th Circuit decides, a US Supreme Court review is likely. That's what everybody is expecting. Until then, until either we hear from the 11th Circuit or the US Supreme Court, covered federal contractors across the country do not have to comply right now with the contractor executive order, but we can implement our own vaccine mandates and testing protocols. Any private business can do that or not. And again, this is going to be a philosophical and business decision by each federal contractor employer. You know, how do we want to do this going forward? Do we want to continue towards compliance so that if this thing goes into effect that we're ready, or are we going to roll the dice and not do anything and see what happens? There are no easy answers. Very quickly, I want to talk about the Ohio OSHA ETS, sorry. This is completely separate from the federal contractor executive order, okay? But you should know about it because you could be a federal contractor that believes that it's not subject to the federal contractor executive order because maybe you don't have those kinds of contracts, but then you might be subject to the OSHA ETS, right? So that's why I want to talk about this real quick. So basically what happened, there was a flurry of activity over the weekend. Earlier this month, I'm sorry, in actually November, wow, it's that far away. Everything is just going by so quickly. So there was a stay or a hold on the OSHA ETS by the Fifth Circuit. There were so many other similar litigation suits around the country that all of those cases were consolidated in the Sixth Circuit Court of Appeals, okay? They were tasked with deciding what to do with this hold that the Fifth Circuit had put on the OSHA ETS. On Friday evening, when we were all done with work and trying to enjoy the weekend, all the employment lawyers and HR compliance professionals were glued to their phones because we found out that late Friday evening, the Sixth Circuit lifted the Fifth Circuit stay blocking the OSHA ETS. And like an hour later, there were appeals to the US Supreme Court by various business and other groups, which, you know, was expected. And then with all this going on, with right now, technically the OSHA ETS is going forward, the Biden administration extended that compliance deadline to February 9th because there was so much uncertainty. They're trying to give affected employers more time. That's where we are then.
And
Finally,
if I can interject for 1 second, this is Diana. I know initially I thought when it moved to the Sixth Circuit, everyone thought since the Sixth Circuit is so conservative that for sure maybe it would be thrown out. So, you know, hearing what we heard is like,
yeah,
wow,
so
you know.
I I was surprised. I have several colleagues who were not surprised. So the 3-judge panel that decided this is considered moderate, but still, I think people were surprised that they lifted it.
Right.
Interestingly, they did not make any decisions on the merits. It was, about procedural things and, damage to what would happen if it doesn't go into effect and all this kind of stuff. So, right now we are still looking at procedural stuff, but I was surprised. I was glued to my phone. I'm like sitting here texting my boss at, 10 p.m. on a Friday, which normally one wouldn't do. So that was very, very interesting. I don't think and it was on a Friday night as well. So yeah, that was a good observation. I personally was surprised. I was not expecting that at all. So I think it took a lot of people off guard. So here we are with that. So yeah, the employers who are subject to this, if you weren't working towards compliance before, you are now. So we have until February 9th for that. And then the CMS order, just really quick, I am not going to talk about this much at all, but it's been halted in Ohio. So right now, there's really nothing much to do. The deadline is still January 4th where it's being implemented, but that's not in Ohio. The CMS has to issue new guidelines because there were a flurry of activity in mid-December on this order. And frankly, nobody really knows what's going on, but in Ohio, it's halted. So if you're subject to this, I would just do a wait and see, frankly. All right, let's talk more about what we're here for, which is the Executive Order 14042. So if it is implemented, we know right now it's on hold, okay? But right now, there's been no extension of this compliance deadline by the White House. So right now it's still January 18th. I'm not really sure, what is going to happen with that. I would think that they're going to have to extend that, but right now, nothing has changed since November 10th. It's still January 18th. I also have a couple of URLs here that are very, very helpful, and I believe you will have this presentation after this webinar, so you can take a look at these things. But the contractor FAQs are actually very, very helpful. They're very detailed, but they're also very helpful. I'd highly recommend that you look through them if you have determined that you're subject to this. Also, if you need a vaccine policy template, OSHA has their own recommended policy. So you may as well use it and not reinvent the wheel. And so there's that policy there if in fact you ever need to have one. So I thought that was helpful. Quick note on the relationship between 14042 and OSHA ETS. It doesn't apply. The OSHA ETS does not apply to employers covered by the Federal Contractor Executive Order. Okay. And regarding state laws or state executive orders that prohibit vaccine mandates, there are several of them out there. This executive order 14042 would supersede any and all state laws or executive orders prohibiting vaccine mandates. And that's because it's federal, so it would supersede that. However, if you have more protective state or local COVID laws, those would continue to apply, such as, mask mandates, social distancing mandates, this and that and the other. All right, penalties for not complying with 14042. So neither the executive order nor the guidance specifies penalties for employer noncompliance. So that is something that is basically a to be determined. However, in the FAQs, very important, it specifically says if a covered contractor is not taking steps to comply, is not taking steps to comply. Significant actions such as termination of the contract should be taken. So a couple weeks ago, when I spoke on this, I said, good idea to keep moving towards compliance, preparing for compliance. I kept saying that. However, now, considering that this thing is on total hold and there is no obligation to comply right now, I think that this should be looked at as a caveat. And I think that if you're negotiating with a federal agency and they say that, well, you're not moving towards compliance, you can say we're not obligated to because of this decision. We're waiting to see what happens. I mean, I think that's a fair retort if they say that. So I still think you should work towards compliance to avoid any potential liability and penalties if it's all of a sudden implemented. But I definitely think that you should be exerting minimal time due to the uncertainty of the implementation. I know that's a very blurry line, but really right now everything is uncertain, and you don't want to spend too much time and resources moving towards compliance if in the end of the day it's going to be not implemented. Okay, I'm really sorry. I don't know whether you guys can see this. It's blocking the my title, but the title of the slide is basically legal exemptions for this executive order. So I think that everybody on this call is used to the medical and religious exemptions for accommodations. For the medical, you would use your normal reasonable accommodation process that employers have for determining ADA requests for accommodation, which should include safety assessments, which of course are key in the situation of COVID. Religious exemptions, you would use your normal reasonable accommodation process that you have for determining Title VII requests for accommodation. But beware that religious accommodations have looser threshold for determining a sincerely held belief. So we're all used to, from the medical standpoint, we're all used to asking for, very specific information on the diagnoses. We're used to getting medical documentation from doctors. We're used to going back to the doctor and saying, can you provide a better note? Because this doesn't make any sense, or this doesn't really tell me, the length or the scope or whatever. We're all used to doing that because we can. It's not like that with religious accommodations. It's not really part of the process to go and ask somebody, oh, can you get a note from your religious person at your temple or your church? The threshold is looser. You don't have to follow an organized religion or a commonly known one to be covered under having a sincerely held belief. And one of the things that employers are struggling with is, how to deal with these exemptions for, either not wearing a mask or not getting vaccinated. And there's probably some out there that talk about not getting tested. There are practical consequences of aggressively questioning employees. Even if you think that they're not being completely forthright, you might lose a lot of good employees if you take that strict approach. I'll give you an example. So I recently dealt with an employee that basically didn't want to wear a mask. And what we found out when we did the interactive process by talking to the business organization was that this person, even well before the pandemic, was very proud of his faith, was very open about it. Everybody knew that he went to church. Everybody knew that he was, a very faith-based person. So, when we're looking at it from an overall standpoint, are we really going to sit here and aggressively ask, do you ever wear a scarf, in the wintertime that covers your face? What's the difference between that and a mask? You could ask a lot of things, but do you really want to fight that battle? Do you really want to try to climb up that hill? And that's, something I cannot answer for you. That's something that I think is a top-down decision. What do the executives, how do they want to deal with this? Do they want to be really strict and aggressively question everybody? Or are you just going to do your job and getting the interactive process done, document everything, and come up with a reasonable accommodation? Safety assessment is going to be a big part of this, which, we're used to doing that because of other accommodations. So that process should already be there. But it is tricky when it comes to religion. Again, it's a case-by-case analysis, and you need to figure out what philosophy you're going to take as far as how aggressive you're going to be with these employees. Another pro tip here, the EEOC, in the beginning of all this pandemic exemption stuff, they put out their own religious accommodation request form as a template. So if you're looking for one, may as well use the one that the government uses for itself, especially since the EEOC is the one that's going to be sitting here looking at your charges that you respond to. All right, factors to consider, and I know I'm way over time, but some of this should be familiar. So the disability, we should all be familiar with the process. So the question is, does the disability conflict with the receiving a vaccine? Can you have a reasonable accommodation that enables the employee to perform the essential functions of the job without creating a direct threat or undue hardship? Those are affirmative defenses, as we all know. Religious exemption. So these are the questions, basic questions that you're going to be asking. And the biggest one is the belief sincerely held. And again, that is a very liberally kind of interpreted question. It's very vague, okay? So assuming that the answer is yes, the next question is, what job requirement does it conflict with, and can we come up with a reasonable accommodation that would enable the employee to do their job without creating an undue hardship? So I'm not going to go through this whole thing right now with you, and you'll get this afterwards, but what is an undue hardship? The one thing I do want to stress is that there is a ton of case law out there that says that when an employer brings up undue hardship as an affirmative defense, they have to provide hard evidence of actual hardship, not speculation. They're talking, they want documents, they want maybe analyses of what you're saying will happen financially or operationally. How do you know that not having this person get a vaccine or wear a mask or whatever, how do you know that's going to cause issues in your operations? Has that happened before in another context? How do you know this? You can't just speculate. What are some other accommodations that you could require? Well, okay, but wear a face mask if you won't get vaccinated. But what if they object to that too? I've dealt with multiple of those since this whole thing started. Physical distance from other coworkers or non-employees, but can they do their job if that happens? Periodic testing for COVID-19, working remotely. But what if working remotely puts that employee at a disadvantage as far as being able to kind of do some projects that maybe helps them in their career? Worst comes to worst, can they accept a reassignment to another position? It's a case-by-case analysis. You're going to have to decide if those safety measures are enough to remove any undue hardship posed by the employee not being vaccinated. And then, of course, what if requiring the employee to adhere to other safety measures is an undue hardship? Okay, so they have to work at a physical distance, but then maybe they can't do part of their job. Then it's not really a reasonable accommodation, is it? So it's not easy. You have to go through the process, have a process, appoint someone to do it, and make sure that you're ready to go. So I'm going to skip over this slide because basically if you're still negotiating contracts, I would see if you could delay it for a bit because we don't know what's going on. certainly try to delay it until after January 18th. Okay, so this is all in the FAQs. I am not going to go through this, but what is sufficient evidence of vaccination status? The one thing I want to mention in the last bullet point is that unlike the OSHA ETS, an attestation of vaccination by the covered contractor employee is not an acceptable substitute for documentation of proof of vaccination. They have to provide actual official documentation that I've listed here. Digital is okay. Can you work with vendors to help collect, review, and retain vaccine cards? Yes, you need to start vetting them now if this is what you're doing. But don't sign anything because we don't know what's going on. You have to have an internal point person for managing the process. It can get out of control very quickly. What process are you going to have for collecting information for employees? Who's the point person for employee questions? That might be somebody different than the person who's managing the process of getting vendors and putting a process in place, because you're going to have questions from employees. You got to have somebody to answer those. And of course, if you don't already, start getting a process down for recording medical and religious exemptions. That's going to be key. Other practical concerns, again, depending on when this goes into effect, you know, employees are going to have to get their doses by a certain time. You're going to have vaccine hesitancy. Your vaccine exemption claims are going to increase. I can tell you that firsthand experience. Interestingly, the vaccine mandates have caused an increase in mask exemption mandates and some other implementation readiness issues. All right, so let's see. I don't believe, let me just looking at this order.
So yeah, we have a handful of questions. Do you want me to read them off to you, or do you want to read them?
Yeah, can you read them?
Sure. So from Lisa Van Zandt, it says, I don't believe that this order applies to our company on its own. However, a sister company of ours just signed a contract with the language that they must comply with the EO 14042. Does this mean that we are now covered by the EO, this EO?
Well, if it is in their contract, your sister employer's contract, but you are not, I mean, you're not a part of that contract, are you? Or could you be interpreted as working towards or with that contract? Because that's the question. If the employees at your company and location can be interpreted as working within the scope of that contract, you may very well be liable for it. I think that it definitely requires a review by your legal counsel, whether internal or external, because I would need to have more information to answer that. I don't think it's an easy yes or no based on just that. No, we aren't a part of the contract. Yeah, as long as there's nobody in your company who is doing any work that could be connected to the covered contract, then you're not covered. Does it matter when the government contract was signed? Are they grandfathered? There was a deadline earlier this year that was the effective date of contracts. I don't remember what it was, but I believe it was a November date, but I don't remember what it was. So you'll have to see when it was signed.
It's a November 15th, I believe, is the date.
November 15th. I don't remember the date. I'm totally blanking on it, but I can get back to you
and we
on
can
that.
always put some of these in a parking lot and send a FAQ back out to everyone.
Yeah, that's a good idea. But yeah, I can easily look that up. For some reason, it did not make it into my presentation. There's been so much cutting and pasting to try to get it down.
Yeah, we told you to cut it down.
Yeah, I know.
20 minutes.
It's not working. So
I'm just joking with you.
Yeah, I don't know the answer right now to this. I'd have to look it up. I can,
Yeah, we'll have
I
time
can
to
try
put
to
it in
look
the
it up
parking
when
lot.
the other speaker is speaking, and I can put it on here. Yeah. What else did I miss here? Okay.
We have one
ETS.
from, go ahead. Does someone else want to speak?
Well, I don't
Okay.
know. I don't
Okay.
want to go out of order. So
Okay, so Angela McDermott, okay. If my company has fewer than 100 employees but works with a company X, that must comply with OSHA's requirements, and company X wants their contracted employees to comply with OSHA's requirements, does our whole company have to comply, or just the employees working with company X? Any guidance into OSHA language?
let's see. Well, I mean, I would, first of all, I would push back on that. Just say that, no, we're not agreeing to this. Second, if they mandate it and you don't want to push back on it because you want the contract, I would take a look at what the contract says, because depending on who the party is to the contract, if the party is the entire company and the contract language says that employees of the entire company have to comply with this vaccine mandate, then yeah, that's the whole company. But if the language says that it's individuals who are working within the scope of this contract, and that would just be the employees working with company X. So again, that is a contract verbiage question.
Hey, Tanya, in the sake of time, let's probably only take one more and then move on to Melissa so we can get through some of the other content, and then we'll just send out a Q&A.
Mary Decker, the answer is yes. You have to maintain documentation.
Okay, so there we go. So yeah, we'll be sending out FAQ and with answers to all of your questions. Please, keep adding them via chat and we will get those taken care of. Okay, so up next is Melissa Weimer. She's going to talk about our hotline and our toolkit. And do you have control now, Melissa? You're on mute still.
I see it. It's there. Or is that from you, Tanya?
No, that's Melissa, but she's still on mute.
Thank you.
You're welcome.
As soon as I shared my screen, it went away. And I was like, I don't know how to mute myself. Yes, so I'm here to talk about our little vaccine mandate toolkit. Working in the compliance department, we've put together a few documents to help our members triumph through this mandate. And we were hesitant to share this once it was put on hold, but now that it's kind of open, we can talk about what we have for the toolkit. So we do in our toolkit on our website. If you go log in first off, and then go to member resources, HR Central, click on the first picture that says alphabetical, and then go to federal contractor, you'll find a list of documents such as the COVID vaccination policy and exemption procedure policy, a frequently asked questions for federal contractors. Some of that is tied to what was mentioned from the task force website, and also some of that is questions that we have received through the hotline. I also created a quick guide to federal contractor mandate. It's a PDF that explains, when the specific dates, including when it was originally to January 18th. We will make sure those are updated once the hold has been lifted and we have more information. But it also goes through what to do with subcontractors, wearing a mask, the kind of the fact that you can't test is kind of a vaccine or nothing situation, what to do with people that are in connection with, and kind of those definitions of who is in connection with your contracts. And then we also have the religious exemption form that was mentioned from the EOC. We took that, uploaded to the website. So you as members have access to these documents, so you don't have to Google search for them. Make your job a little bit easier. You can also contact myself or any of my amazing hotline team members, and we will send it to you with no issue. So speaking of, let me get my computer to move. Speaking of our hotline, we're always here to help you. So we stay up to date on laws and COVID updates and other compliance items, so you don't have to. We provide Heard It on the Hotline emails to all our members, legal alerts, policy reviews, surveys, compensations, handbook reviews. I know personally I've been asked to add a couple COVID related policies into the handbook in preparation for the OSHA ETS, but also the federal contractors. And if you have any questions, feel free to reach out to us via phone or email, or if you click the little hotline button on our website, it'll send us an email and we would be happy to assist you. Outside of that, that was pretty brief. So if anyone has any questions, please feel free to throw those in the chat. If not, it was nice to be able to chat with all of you on the presentation.
Thank you so much, Melissa. Okay, so we don't have any questions right now. Later on, if you think of something, feel free to put it in the chat or email one of us and we'll respond. Up next is Diana. She's going to be talking about service agreements and an update on the verification process.
All right. Let's see. I'm looking for my little thing up at the top. Like you said, what do I need to hover over it so it'll stop? I can see where I usually hit play. Can you hear me okay?
Are you trying to expand the presentation?
Yes, yes. I was trying to do it from the top, but I have a bar, just like Latha was referencing. Is there a way to do it from another spot?
Down below on the
right where I have your picture over right now. Got it. Okay, there we go. Technology. Great. We should all be used to this by now, right?
Yeah.
I want to thank Melissa and Latha for joining us today. Definitely a lot of great information, and everything is so fluid and moving on a regular basis. As you see, my screen is all this stuff at the top too, so it's covering my titles, and if so, it's no big deal, but I just wasn't sure what's in view on your end.
Yeah, we could see it. You can see the title.
Okay. All right, well, I'll just keep going. We'll figure it out. Awesome. So, and we had mentioned, again, Latha is on the board with the Ohio ILG, and that is an organization. It stands for Ohio Industry Liaison Group. So a lot of different affirmative action plan or federal contract companies come together and share best practices. We hear presentations, et cetera. So, you know, if any of you who are federal contractors aren't part of that, definitely a great resource. And if you're not, you know, we do cascade a lot of the information that we hear. And that's how we ended up having Latha join us today as well. So, and then I'm sure our hotline or advisory services group, which is where our hotline team for ERA, will probably have more to come with all of the new unfolding changes with ETS. So I don't want to speak on their behalf, but we always send out those blasts and alerts. So just wanted to make reference to that as well. So as reference, I'll be covering the service agreement submission process, the OFCCP AAP verification interface update. So those are a couple of things that we want to make sure we align everyone on. So effective in 2022, we're going to transition to a common submission date for ERA AAP service agreement. So for those of you who have been with us for a while, you may not have even received a service agreement once upon a time, but we did transition to that in 2020 under Michael's leadership, just to definitely make sure we're all in alignment with the scope of the work that we perform for you. And so now, not only do we want to make sure all members who utilize our AAP services have a service agreement, but in order for us to better forecast when to get things done and to eliminate some of the bottlenecks that we found that can occur, because we all know when plans are due, and we send out reminders, and for various reasons, sometimes we may not get all of the data to do the plans, and then that kind of backs up our log of plan completion. And we don't want our members to experience any delays once they submit their information. So that's one of the biggest reasons that we're looking to transition to this date. So even if your plan's not due until November or July or whatever, we still want to go ahead and get the service agreements done in the beginning of the year. And so with that said, our new expectation is that we'll send out a draft of service agreements, based on those who did do plans with us in 2021. And we're looking to send those out the week of January 10th. So we're working on all that right now. And then once you receive your service agreement, we would like for you to sign and return the service agreement to us by February 4th. So then we can start to compile our schedule for the year. So I wanted to communicate that change for the year. And I think I'm missing a slide here. Let's see here. Yeah. I put the other slide in ahead of this. And then a few other gaps we wanted to bring to your attention that, as the AAP liaison or coordinator for your organization, sometimes when we're finding when a liaison or coordinator leaves the member's company, the new person responsible for AAP doesn't always know, who to call and what to do and all that. So, we found that that's definitely something we'd like to address in the coming year. And then in addition to that, number 2 is just referencing as far as our invoices are concerned, sometimes we're not always getting those to the correct person. So proposed solutions for that for 2022 is that we get 2 email addresses for invoices so that we can submit the invoice to 2 individuals in your organization. So if you haven't already provided, and one could be just your AP coordinator, the accounts payable coordinator for your organization, and the AAP person, whomever it would be most applicable based on how the bills are processed. So we'd like to get that on file in our Salesforce system. And then also we'd like to have the name and email of a second resource we can contact about AAP follow-up. In the event, you get a great new job and you leave and AAP is the last thing on your mind. So we know that happens. And so, but it just helps us to, not have to try to make those determinations, when that transition of duties don't go as planned. Okay. So the slide before this, if you have a cell phone, and I'm not going to take time to show this, but I did create a poll because I'm just curious for those who are on the call today, how many are currently using the ERA AAP service. So if you have your cell phone, all you have to do is hover over the code. It'll take you straight to the survey. And if you could be so kind as to fill that out, we just wanted to later after the presentation's over, just get a feel for what sort of follow-up potentially might be needed. Or you can also even copy and paste the link that's there. It's mentee.com/EK51, R as in rainbow, I as in ice, N as in Nancy, B as in Bravo, 9W. So again, if you so kindly could help us with that, that would be great. All right, so going on to the Affirmative Action Program Verification Interface, it will be new for 2022. And as other things, you know, it's been a little fluid, but I think we're finally in a space where things will start to move forward. So I'll talk to you briefly about what it is, what you need to do, and the timeline associated with this. So in August of this year, the Office of Management and Budget, they call it the OMB, approved that the OFCCP information collection request for the Affirmative Action Program verification interface through a new online portal. And they're calling this portal, it changed names, I think a couple times, but now it's called the Contractor Portal. So on December 2nd, so many of you may already be aware of this. So if you're not, we're here to tell you and make sure that we're all on the same page. They sent out a blast, OFCCP did send out a blast, and email blast, and it does have, you know, the timeline, FAQs, etc. And the link that's shown here, and we'll get this out to everyone. In addition, it will be located on our HR Central. It's not there yet because right now, you know, with the holidays, we have a few resources off, and we don't have the ability to update it just yet, but it will be out there. But this link here will show you all of the FAQs that's related to this, and it's pretty informative. So definitely a great resource to have in your toolkit. Why did they do this? You know, they basically wanted to upgrade security was one reason. I think in one presentation I said, and they talked about how a lot of the auditors have company information on laptops, and if they leave, you know, and all this stuff. So there were a lot of security concerns. But in addition, they wanted to reduce the audit burden of good contractors. And so there's a theory out there that most of the contractors are not compliant, and the OFCCP have been fishing from the same pond, for lack of better words. And that means they were auditing the same companies over and over again. So if some of you have been subjected to that, you probably can identify, you know, and relate to what that means. And so this will be a way for them to truly start to connect with those contractors who potentially may not be fulfilling all of the requirements. Another link, and this again will be in the presentation, is their landing page, you know, for this verification. And on this page, there's several great resources, the FAQs that I've already referenced. They're going to have some how-to videos coming up soon. You know, the timeline, which I'll share with you in a second. And then there's also a user guide and references that they'll have coming soon. So as of last night, they still were not there. They still had coming soon there. But again, just wanted to share that with you. So who will this impact? Supply and services contractors and subcontractors, you know, who meet certain jurisdiction thresholds are required to use the Contractor Portal to register and certify their AAP compliance. Specifically, contractors that hold a contract of 50,000 or more and employ 50 or more employees must develop and maintain AAPs in pursuant of Executive Order 11246 and Section 503 of the Rehabilitation Act of 1973. If a contractor has at least 50 employees and a contract of 150,000 or more, then it must also develop an AAP pursuant to the Vietnam Veterans Readjustment Act of 1974. And so again, this is all outlined on that website in the FAQs. So there's two main things, you know, that is part of this first phase. The first thing is just to require contractors to log in on an annual basis and certify it is in compliance with the OFCCP requirements. And then for those who are scheduled for an audit, it will require contractors to upload the desk audit submission to the portal. You know, again, so they're trying to eliminate emails and all those things. And so it's all going to be done through this particular portal. They are anticipating, in that small note to the right, that the plans will possibly need to be uploaded in the future as part of phase 2. So right now you do not have to upload your plans, but in the future, you best be reassured that that will probably be the next phase of this. So for those contractors who've tried to skirt around doing a plan and haven't gotten audited and successfully have kind of managed, this will definitely be a way to try to minimize that. All right. So from what we understand, there'll be 3 options when you go in to certify. The first one is the entity has developed and maintained affirmative action programs at each establishment as applicable and or for each functional or business unit. Option 2 is the entity has been party to a qualifying federal contract or subcontract for 120 days or more and has not developed and maintained an affirmative action program at each establishment or as applicable. So again, option 2 is saying, we are a contract, but we haven't did it. So it's self-disclosing. And then option 3, the entity became a federal contractor or subcontractor within the past 120 days and therefore has not yet developed applicable affirmative action programs yet, but they're working on it. So that's just a FYI on that. And so not only is it just about doing the plan, but it's about the affirmative action program requirements as well. So we want to make sure that you're fully aware, okay, yes, you need to have the annual AAP plan, the identification of problem areas, the personnel activity analysis, the evaluation of compensation systems, your good faith efforts, your listings with the state employment office, your EEO clause, where it needs to be, and the physical or electronic posters, so that's all part of the whole program. So as you go into the portal, those will be other pieces. It's just not about the plan, it's about your whole program as well. So the timeline, and how do I don't know why that bar is there. Let me hit a button and hope you all just don't go away once I do that. So, let me see. Well, that's not working. I don't know why that's still showing. It usually is at the bottom, and I must have did something goofy to have that showing there. So sorry about that. But so what's happening is, from a timeline perspective, February, and I can't even see the date, but you will see this when you get the PowerPoint presentation. That's when it actually opens. I want to say it's the 1st or the 9th, but I don't have that paper printed, but it's up under there. Oh wait, I can.
First.
First, great. I was going to say, because I have 2 computers going here, so I should just poke through this one. Yeah, so February 1st, the registration opens, and what that means is the federal contractors will be able to visit and register their company. So you'll need your EIN, your VIN numbers, and all that for your organization, and validate that your information is correct. And then starting on March 31st of 2022, that's when they actually will have the certification period beginning. And so you can go in anytime between the 31st, but it has to be before or by June 30th. That's when it ends. And that's when you will actually be able to certify the status of your AAPs for each establishment and or functional unit as applicable. And then, you need to do it before that period ends. So from what we're understanding, the OFCCP will send out email blasts to everyone that is identified, and you will be receiving that. So just wanted to make sure you're prepared and aware. So action items, next steps, in the meantime, until they do that in February, you probably should start to evaluate your EEO1 reporting structure and make sure, look at it against your AAP structure. And you could do that now because, I know the EEO1 portal is closed and it doesn't, so hopefully you did update your EEO1 because it doesn't reopen until, I believe it's April 12th of 2022. However, if anyone does need we did download the last Q&A. It's like a 26 or 28 page document. Carolyn had that downloaded. So it has a lot of definitions and things if you're not very familiar with the EEO1. So we can always send that to you, and we'll probably post it out somewhere on our website as well. Then step 2 is develop your AAP when it's due. So we know that, many have different dates, for their AAP. Step 3 is to register on the portal starting February 1st. And then of course, certify between that March 31st and June 30th day. And the email blast will be, I think, the generation of the list and who to email is from that federal procurement database system and the systems for award management, the SAM system as well. So, And I think that's it. So because I know we're running very close on time and Tanya has additional very important information to share, any questions you may have, put them in the chat and we'll compile all the questions and definitely get those answers back out to everyone. So we thank you. We appreciate your support of our business and of our Lunch and Learns, and any new titles or topics that you'd like for the future, please let us know. And I'll turn it back over to you, Tanya.
Hey, thank you so much, Diana. Okay, can everybody see my screen now?
Yes.
Okay, thank you. There we go. Okay, so we're talking about our new AAP platform and the templates and checklists that we have that are associated with that. And the reason why we went to a new platform is that we wanted to find ways to improve our turnaround time, you know, getting those plans back to you. And also we know that the focus is going to be on salary compensation in the coming year. So we wanted a platform that would give additional options in how you analyze that data. Just let me go back. Give me one moment and I will run you through those spreadsheets. I have to share screen. Here we go. Okay, can everybody see this Excel spreadsheet?
Yes.
Okay, great. Okay, so this is pretty similar to the data we've asked, you know, year over year. This first template is the roster. It's going to be a snapshot as the first day of the plan year. I've got definitions and formatting requirements for every column header. The blue columns, they are the minimal required data to complete an AAP plan. The yellow is optional but recommended. And what this really means is that, yes, we can create your AAP plan with just the blue data. But if you're to be audited, the auditors can come and ask for like date of birth, and then they can ask for like total salary. And they can also ask for pay analysis groups. So you have that. Let's see. If you don't currently provide this data, that's something you can work on for the future. Because I know that not everyone does, but it's kind of like taking a bite rather than trying to swallow everything whole. Sorry. Come here, Bose. And they're really, we only have 3 new columns that we're asking for. We've got the hours worked. We normally don't ask for that. We've got the part-time status versus full-time status. And we also have supervisor ID. And basically what the supervisor ID is just the supervisor's employee number. And I'll give you an example. So we have Drew Lumbell, here's his employee number. He's a supervisor of Augustine. So over on Augustine's line for supervisor, sorry, this is getting a little twitchy. Right here, we have that employee ID. Okay. Also, if you have an AAP that your company does it by function, you'll have to fill out this column right here, forced into location. Okay, and then here's the activity tab. Previously, we would have you provide the applicants, the hires and the terminations and the promotions on different spreadsheets. With this new tool, we ask that you provide all those activities on one spreadsheet. And we have, again, there's definitions for each column header. these activities right here, again, they're applicants, hires, promotions, and terminations. For this line right here, this individual applicant. So for the employee ID, there wouldn't be any because they're just an applicant at that point. You come over here for disposition. Yeah, anyone who's an applicant has to have a disposition. I've provided you some examples right here. Let's go through hires. So if you have an applicant and they've been dispositioned to hire, they'll also need a hire record. If you have a promotion from promotion to, you'll need a promotion from record. I am so sorry about that. So we've got that. Again, and we break down terms in voluntary and involuntary. So show you the checklist. Can everybody see the checklist now?
If you switch from the template, no, I don't see a checklist. Oh, wait. Yeah, I don't see any checklist, I don't think, unless, is it just a different tab or a different document you just put up?
It's a Word document.
Okay, no, I don't see it.
Okay, one moment.
Yeah.
Okay. Oh God.
Tanya, if your house is like mine, your dog's probably barking at all those Amazon trucks coming to the house for help.
I know, and it's just like, and he was so quiet. This is the first time. Oh, come here. That's exactly what he's doing, and I'm so sorry. Okay, so let me share my screen again. Let's try this. Here we go. Okay, so
Okay, I see it now.
great. Okay, so this is just a data submission. Sorry, data submission checklist. The employee roster template. You know, we're just this is a double check. Basically, for the workforce roster, all employees on a payroll as of the plan date should have one record. We want to make sure that the race and genders are all filled. And except once you pull all your data together, just go through this checklist and make sure that you know, you have everything covered. When you come over here to employee activity template, applicants, you know, things like ensure all applicants who applied for a requisition that filled during the record keeping period are included on the employee activity template. That means, like, if someone applied for a job in 2020, but the job didn't get filled in 2021, they still need to be on the 2021 data because that's when that requisition was filled. And we just go through and break down applicant, hires, promotions, yeah, and terminations. And just make sure that all your data complies with this checklist and you'll be in great position. And also, again, we want to improve our turnaround time. So this is one of the ways that we're trying to promote that. Okay, does anybody have any questions? If you do, please, you know, put them in the chat and I will make sure to get back with everyone. Also, 2018 census data, because can everybody see my screen again? Where I'm back.
If it's a new document, no, I still see the checklist.
Right. Okay, so I'll share, go to share.
And while you're doing that, the two documents Tanya just showed are extremely important for those of you who have been, we've provided services for, because quite often what we find adds a lot more time to the process is the need to go back and forth to change data and make sure we have all of the data that are in the columns provided. So our hope is that by providing this template, being the first of the year, if it can start to be utilized, it will make things go a lot smoother if you could submit it in this format. So that's our dream.
That's right, thanks. Okay, and so now we have 2018 census data. So when you submit your form, you know, maybe you still have 2010 data. that's fine. This new tool has a crosswalk where it will convert 2010 codes to 2018. Although we ask is when you get your plan back, you review those and make sure that you agree with the new code that's being given to each of the jobs. Okay. There we go. Again, any questions, please put them in the chat and we will follow that up with FAQ. And, again, we want to thank Latha for participating in today's presentation. And thank you so much for rushing this morning and making all the changes to your slides. We really appreciate that.
Thanks for having me. I really appreciate it.
Thank you. Yeah, and so our next presentation will be quarterly review, will be tentatively March 4th, and that'll be a 2-hour presentation, and that's where we're going to be going over, you have your plan back, you have goals, here's how you reach those goals, here are the steps you take to ensure that you're still compliant with your AAP. Okay. And if there's not anything else, anyone else, Diana, Melissa?
I just want to thank everyone for attending. Again, we just started this last quarter, and so just trying to establish the momentum and making sure that it's a value add for what you need to do as a government contract. So thank you.
Okay, and we'll be sending out a survey later on. Please take a moment and complete that for us. We appreciate that. And if there's nothing else, this concludes today's meeting. Thank you so much.
Have a happy holiday, everyone. Take care.
Bye.
So Tanya.